Hello, welcome to Deaf Health Talks. The topic of tonight is expecting a baby, what you need to know about the fourth trimester. So Deaf Health Talks, or DHT, is a virtual health community education program for the deaf and hard of hearing community. We usually host these both on Zoom and Facebook Live. We tend to do these every month. And we have a variety of health topics that we discuss. If there's anything that you're interested in and want more information about, please sign up for our mailing list or type it in the chat. And DHT is really the collaborative effort of many different organizations. Thank you so much to the University of Michigan Department of Family Medicine, MDDA program, which is the Michigan Deaf Health Partnership in Deaf Health, the Michigan Medical Interpreter Services. We also have live captioning tonight, and we welcome any questions that you have. Please put those in the chat. We will have a resource guide and other information that we will put in the comments. Tonight, our deaf health topic is expecting a baby, what you need to know about the fourth trimester. I'm going to go ahead and introduce myself. My name is Shazia Siddiqui, and I will be the moderator for tonight. And I am a postdoc fellow at the University of Rochester Medical Center in the OBGYN department. And tonight's topic about the fourth trimester, really what that means is the 12-week period right after somebody gives birth. Really that time is, there's a lot going on physically, emotionally. It's a big life change to have a baby. And for that baby to be out of the womb really changes a parent's life. Tonight, we're going to be using gender inclusive language during this presentation, which means you might hear the term birthing person, birthing people, and pregnant people. I am going to go ahead and introduce our presenters for tonight. Hi, everyone. My name is Tiffany Panko. This is my sign name. I am a doctor, and I am also a researcher in women's health. I work at the Deaf Health Lab at RIT-NTID. And I'm going to go on to the next person. Hi, everyone. My name is Kimberly Kelstone, and I am a midwife. I'm a certified nurse midwife, which means I deliver babies in the hospital here in Virginia. I also used to work as an interpreter, which I did for many years in Rochester. So midwives help deliver babies, and they also take care of women and people throughout their lives. And we really provide healthcare in contraception, in helping people to conceive, and a whole other range of health topics. I'll move on to the next person. Hello, everyone. I am Dr. Glashanda, lawyer. And I'm not a doctor, but I am a professor in deaf studies and interpreting education at Utah Valley University. Prior to this, I also worked as a doula, and I supported people who were about to give birth and also supported people right after they gave birth. I am also a certified interpreter. I am hard of hearing. Very excited to be here tonight. I work on disability, reproductive justice with a lot of different communities. Okay, move on to the next person. Hi, everyone. My name is Kat Head. I live and work in Rochester, New York. And I work as a postpartum doula, meaning that after someone has given birth, during that fourth trimester, those 3 months after they give birth, I go into their homes, give them support both physically, emotionally, and helping them learn how to take care of a newborn baby. I also help with things around the home, such as cooking, cleaning, and any other ways that new parents need support. I have been doing this work since 2018. I really enjoy it so far. And last year I became a certified lactation consultant, which means I support people through the breastfeeding process. Thank you so much for having me tonight. Yes, thank you everyone for joining. I'm very excited. We have a great panel tonight, and we are going to have start with Tiffany and go through our other presenters. And if there's any question you have, please put it in the chat and we will try to answer it towards the end of the presentation. Thank you so much. Okay, excellent. So like I mentioned, I am a researcher. I'm just gonna talk to you about a couple of the topics that I research. One of them is about the fourth trimester, which refers to the first 3 months after giving birth.
This is sometimes called the baby blues. And sometimes it's very awkward when you're a new mother. You don't get enough sleep, you're irritated, and this happens, but it's labeled postpartum depression, PPD. And it means that after birth, you develop depression from that time on. And it happens right after birth, or it can be up to 1 year after giving birth. Really, it's more common than people realize. If you
So
imagine
out
that there
of
are
actually 7 parents, 1 in 7 people will experience postpartum depression. And I know right now with COVID, there are a lot of things that have gone awry in people's lives. And people have been going through so many different life changes. And actually, everything that's been going on with COVID seems to have caused an increase in postpartum depression. And if it's not treated, it impacts both the parents and children. For example, maybe after maybe a baby has a low birth weight, maybe someone is struggling with breastfeeding, and we can already detect some of those things in the first 3 months. And postpartum depression definitely can have an impact on an infant's development. I also want to talk about family planning. I'm sure some people cannot conceive right away. So if you think about out of 10 pregnancies, 7 of them are unplanned. So unplanned pregnancies are very common. And there has been some research that the deaf community is more likely to have unplanned pregnancies compared to the general population. So some people, if they want to expand their family, they really need to think about the whole year after and everything that encompasses, including breastfeeding and everything that goes into the first year of a baby's life. Yeah, so there's just something that I wanted to add. So if you go to the doctor or midwife after you give birth and you come to our office, maybe 2 to 6 weeks after you give birth, there are a lot of things that we have during that first conversation, how you're feeling, what your experience was like. Like Tiffany mentioned, it's really important to talk about how you're feeling and how your moods are. So during the first 2 weeks, your emotions are really going to be up and down, and that is totally normal. But if you start to experience more severe anxiety and depression, both of those things can happen and are related to the hormones and chemical changes that are going on within our bodies after we give birth. We will also talk about how things are going with your baby, whether you're bottle feeding or nursing, if you have a good family support, if you feel safe at home, if you have gone back to your regular sexual activities or not. We'll also do a full physical exam, check your blood pressure, your heart, your thyroid. We'll check your breasts if you have any complaints or any soreness or pain or notice any lumps, we'll check that. If it's time for your pap smear, we can do that as well after you give birth. Also, if you had any stitches after you gave birth, or if you had a cesarean section, we will check that out and make sure that you are recovering well. We will also check your estrogen and testosterone, make sure that we'll check for hemorrhoids, um, see if there's any problems with that. We'll make sure that you are able to go to the bathroom okay. If you had any issues with diabetes or issues with blood pressure, we can do blood work during that regular exam. And really, after those 2 weeks and 6 weeks, we will talk about if you want to have some contraception or talk about your family planning, talk about the next time that you maybe plan to get pregnant. We'll talk about the appropriate wait period for that and make sure that you are healthy for whatever your plans are next after that birth. And I will go on to the next panelist. Thank you, Tiffany and Kimberly. You made some excellent points. So I also want to bring the point of disability justice and how that equates to reproductive justice and why this is important. So far, my work has focused on different people with a variety of disabilities that are both disabled, the BIPOC community, people who don't speak or use English. And really what I've noticed is that these communities tend to have higher rates of health concerns. And they also experience higher rates of oppression. And when it comes to family planning, maybe they haven't thought about all of the different factors that are involved. There's racism, classism, ableism, and how these different types of oppression impact people's both physical and mental health. So if a birthing person's health is impacted, that may have an impact on the baby. Having higher rates of anxiety may lead to increased lengths of hospital stays, and you have to think about all of the different appointments and systemic oppression that can lead to effects on mental health. I think it is also important when I'm working with different people to always have conversations about what their life experiences are before the baby, what responsibilities you may have. And we need to think about the term disembodiment, which means if you don't have access to language, or people who don't have access to people who use their first language, where are the doctors that sign? Where are the nurses that sign? When they go to an appointment, they have to switch. They have to code switch to match the culture of their providers. And sometimes people are not prepared for ableism. And they need to think about if they give birth, what happens if they can't bring the baby home, and what type of psychological and emotional impacts that will have, and if they have other children, how bringing a new baby into the home will affect them. And we need to think about how disabled people have different experiences. And we need to think about the birthing experiences both before, during, and after birth.
So there has to be a dependency of the policy for the disability people to have equality and to be able to depend on each other, which means that the fourth trimester includes a support system ready to provide food, bathing, help with birthing, rest. And we need this in our community, in our BIPOC community, so that we don't have this deprivation. What we're really trying to encourage is for birthing people who help with birth to consider that. And then after birth, that should be considered too. So now I'm going to go to the next speaker. And hello there. My topic is the topic of interdependency. That is really important. We have people who are supportive advocates, people who know what to do. They're ready to roll up their sleeves and give support. So how we set this out, we have this ready for you to succeed. There are two things that are really together, but first of all is the planning, and the second is the community. The planning part is that you know people who will say you have to write down your birth plan. You absolutely have to do that. And that is good advice to suggest that. And for postpartum, there should be a plan as well. And you can have this set up so that you can imagine and plan for the time after you've given birth. And when you get home and you're home, okay, I'm at home with the baby. You have to think about this. What am I going to do now? Who is going to be able to help me with all these different things that I need? Who could be responsible for this? Who could cook for me? Who could, who will take care of the other children I have? Who will give them rides to school? And with postpartum planning, this will help you imagine and envision life if something unknown were to happen. You have an opportunity to have it set up and to make the plans for that ahead of time. So it could be, laundry, just regular stuff, cooking, and what's more, the emotional support for yourself. So think about who it is who could come in and who would really absolutely listen to you and know what sort of help you need in your postpartum experience. So someone who can interact with your children and take them off with them, or thinking about people who are there who can come and who can support you. Another thing that's very important about postpartum planning is self-analysis. If you can foresee, well, I feel as though I might be depressed, and I've already had this experience before, maybe it will pop up again. And so analyze yourself, think about that for yourself, and that's very beneficial for you. If you already have a plan for a depressive period, think of what can help you feel more like yourself, or feel like, I'm very anxious, and I look back and say, well, now how did I solve that problem I had before, and apply it again. So this really helps if you can analyze yourself and see what's happened so far that has worked, what you like, what you don't like, how it is you feel comfortable with asking for help. And perhaps you can then practice asking for help and see how it is. Analyze yourself. That's very important. And with the community, I suggest that before the birth, while you are still pregnant, to figure out who your friends are and who the family are. Where are the best parents? Oh my goodness, they're such great role models. I want to be just like them. So see how they work with things and contact them and say, I'm pregnant now. And later, I don't mind. If you don't mind, if I have a struggle, could you come help me out? And I guarantee you this person will say yes. They'll be so touched that you've asked. Of course, they'll say yes. So you can see who it is who could come and give me support. And parents have the same issues come up again and again, and they will contact one another. Okay, sorry, I'm looking up and down here. Okay, community and friends, family, building more relationships to get someone to come right away if you need them. And also the professional community again, doctors, midwives, doulas, postpartum doulas, mental health support, people in your area who you know have already provided the best services. Have a list of their names. And if you really, really feel you can after postpartum, you really, for example, for mental health, if you need help, get an appointment. Go ahead. And 4 weeks, 6 weeks, 8 weeks out, go ahead and make an appointment. And if you need it, it's there. You'll already have it. So you don't have to call and go through it, make an appointment. You'll already have the appointment ready. It'll be set up for you. Another good idea is a pelvic floor therapy. That is great. It doesn't matter if you had a vaginal birth or a C-section. That kind of therapy is very helpful. And if you're wondering about what is that, go ahead before the birth, make an appointment, and be ready for it. And if later on you figure you don't need it, well, then you can cancel it. But thinking about the professional community in your area, where you can get good help, where you can get the best people, and grab them up, keep them in the back of your mind for if they're needed, then you can apply that. So that's really me. Now the next person to go ahead, please. Oh, thank you so much. Yes. Sometimes people say the fourth trimester is worse than the other trimesters. There's so much change. You don't know what to do. Your body is healing, the baby is crying all the time. And also, it's a wonderful time as well to bond with the baby. So hopefully, these presenters will give you some tidbits, some hints about what the fourth trimester looks like. And so now we're going to take some questions. All right. So I'm going to read through them right now. Okay, got them. Let's see. Okay, we have a question now that says, are there any, let me read it again. Oh, so many are coming up. Hang on, this is great. Are there any good blogs or vlogs or support groups for new deaf and hard of hearing parents? And I'll let the presenters open it up for their answers to that. Oh, can you see me okay now? Okay, very good. It's funny, this is perfect timing for this question. I think it was 2 days ago, maybe 3 days ago. I was on Instagram talking to a deaf counseling center, a national deaf counseling center, and I asked, well, I didn't ask, I saw that they had a story about people who really wanted to have deaf support, postpartum support on visual. It seems that the Deaf Counseling Center is going to go ahead and host and run that sort of a group. So one of very good things for postpartum internationally is a group that provides a whole slew of supports, very different, lots of different groups, and all the people who've experienced postpartum life after birth. So they had told me just recently, it was an email, I said, do you have any deaf groups? Do you have interpreters? What do you have? And they let me know that pretty soon they are going to start running an ASL, meaning deaf, but also ASL. There'll be captions there. There'll be a support group for postpartum groups, individuals. And it will be free. There'll be no cost for it at all. It'll be on Zoom. And we're hopefully going to have that set up soon, I'm hoping. So those are two options that you have right there. It's definitely, if you can find a support group in person or on Zoom, go ahead. That's beautiful because you can give your story and see that you share stories with other people and feel relieved that I'm not the only one. My life is not totally off track. I'm not doing everything wrong. No, you'll see that you have shared experiences with other people. And it's very wonderful if you can find someone that you can get in with right away. Great. Now, are there other presenters who want to give their thoughts? Oh, yes. Now with postpartum, the international group, there's a link in the chat, okay? Okay. Okay, now.
I'm a 25-year-old woman, and for the first time, I experienced a miscarriage. I had regular menstruation, and my question is why I'm not able to get pregnant, even though I have been ovulating regularly. I'm having a hard time finding people who have the same experience, who have had finding other deaf women who have had a miscarriage, and I'm struggling to find more tips and resources about this. So really the question is related to why am I unable to get pregnant even though I'm still ovulating? I mean, really, it can take up to 1 year to have a successful pregnancy. So the fact that it happened once means that it can happen again. And really, the human body biologically is very complicated. So you may ovulate and the sperm and egg must meet within 24 hours. You might want to have your partner's sperm checked. You, if you are overweight, you may have some additional struggles with hormones. And it's important to find a provider that supports you, that's willing to listen to you, and that you find helpful. I mean, really, a lot of providers don't do enough blood work and additional labs either until you have you have been trying to get pregnant for up to 1 year, or until you have a miscarriage up to 3 times. And at that point, they will call for additional labs and testing. So I'm sorry that's not a very specific medical answer, but I do feel for you and know that it definitely can be a challenge. And the next question is, I'm trying to find a good baby monitor to use overnight. I did look on HomeAware and Indigo, and I'm wondering if you have any good resources for baby alert or baby monitors to use overnight. Does anyone have any suggestions? Well, really, I do work with families overnight, but a good brand or specific one, I'm not sure. My recommendation would be, for baby things in general, when you ask what's a good company or a good brand for that, you can look on social media, look on Instagram, Facebook. I know that Facebook has so many different new parent groups. There are so many different forums on Facebook. So I suggest that maybe you type a post and you'll have several people respond and say, "Oh, I love this brand for this, and I love this brand for that." So I think that's one way that you can post in a parent Facebook group and just see if there's any consensus about what people reply. Know that it is limited. Um, you might not find a specific product, but I do think that that would be a good approach. Okay, the next question. Is there a directory for deaf and hard of hearing ASL friendly birth and postpartum providers in the US? I think I've seen some websites, but I don't know if they've been updated or current. Are any of you aware? I think there is a website that we put in the chat. It's called aslbirth.wixsite.com. And they do have some information on there, but it might not be updated. You can fill out a form. I added my information on there because I wanted to subscribe about 9 months ago, and I haven't gotten any information back, so I'm not sure. Yep, that's the website. Okay, the next question. What is the best thing that you can do to prepare for the actual birth, for the actual delivery? Patience. That's one thing that is very important, is to have patience. One thing that I say is that it is a marathon, not a sprint, even though I know that the actual delivery is one day. I know many people think, you're really preparing for your body and for the birth itself, so trying to get information and counseling about what you're eating, your activities, what you're doing, what your emotions are like. Really, all of that is involved in the birthing plan. So really, you need to start thinking about that um, while you're pregnant. Don't wait until the ninth month of your pregnancy. It's really important to start thinking about that early during your pregnancy. The next thing is where you can go for, how to find the right midwife or clinician or provider. Where can you go to find that?
You can find out from other people who have their experience. Often you can interact with people. Sometimes in the offices, it's required to cure. They're required to provide accessible captions. So that I know of, I'm the only signing midwife that's practicing here in Virginia, but I believe there are one or two or three other ones more west from here. And there are very few signing OBGYNs. And one who lives in Texas, who is himself a professional ultrasonographer. So, no, the doctor should be, but the focus of the work is on high risk, more for high risk OBGYN. So that's what the practice is focused on, and the ultrasound for the baby to analyze the baby. It's hard to find someone who can sign. Some communities have a very strong interpreter service and that clinic who's very motivated to provide interpreters and have them there accessible to you. Some it is a struggle for and a challenge. And so you have to make connections to try to find the best place. So there you go. Okay, this leads to our next question. If there's no accessible place, and I wanted to, Glashonda had something that she wanted to say before. Please go ahead. Oh, I just wanted to add that I feel that you found the right clinician would be like, it's like a date, right? You don't just pick the first person you go with. You meet, you chat, you find out if you're a good match or not, and then you try someone else until you, and really find out and believe that you have the same beliefs and know that they will provide the support you need. And so sometimes you have to keep looking and trying again and again until you feel satisfied with the clinician. So it's important to write down what it is you're thinking about. What are your priorities? What are the things that you really want from your provider? And the things that I will not agree to have, and the things that I can be, I can be flexible with. So it's important to think about these things and then to start meeting with different providers. Mm-hmm. Oh, and also when you sit down with different providers, when you find the one that you can stay with, that's great. If later on you feel as though, you just get this instinct that it's not working out. Before they seem like a good fit, but now they feel as though it's not a good fit anymore, you can go ahead and transfer. It is your right to. You're not married to them. If you were married to them, you can get divorced, right? So you don't owe the doctor anything. If you don't feel safe, if you don't feel like you're heard, if you don't feel respected, right away, transfer, find another doctor. Because that is really the doctor is really your baby's doctor. This is your doctor. You know, always, if you find a doctor, any doctor you don't like, get rid of them. Find another one you do like. So, but I'm thinking that it doesn't matter if you've been with them for a while. It's like, bye-bye. You can always get another doctor. It doesn't matter. And I am a person who is a provider, and I provide support and care. And I would love to hear feedback about your reason why you're transferring. If you understand what I mean, it's many of my colleagues should know why someone is leaving their practice, because they don't know. Maybe, well, I don't know. Maybe they were insulted. Maybe I made a mistake. Maybe it's my office staff. I have no idea why. So it really helps us to have feedback, please. You can write it up. You can have a direct conversation, but whatever you do, it's let them know the feedback. Let them know why, because that can be beneficial for everyone from that time on, for other people as well. Yes, I agree with that very much. And if you can see who it is who you fit with, nurse, midwife, whomever, and the interpreter too. Because if you go along, you say, yes, that is the interpreter I want to have with me from now on. You know, tell the interpreter, I would like to have you for this. And not just say, oh, I can have whoever. You know, you could have, it works for both. Okay, now for safe, is it safe to get vaccines while you're pregnant or after the birth?
Specifically the
Oh,
COVID
yeah,
vaccine.
the COVID vaccine. Thank you. The interpreter missed that part. Sure. Go for it.
Yes. So really the Tdap, the flu, and the COVID vaccine are all safe to get while you're pregnant. And there is just one more thing that I wanted to add about that. What's cool about vaccines is that actually when a pregnant person gets a vaccine and they give and the vaccine triggers your immune response and creates antibodies, those antibodies will actually go through the placenta to your baby, which means that when you give birth, the baby will also have protection against those viruses. And we have one more question. How can you best advocate for yourself? Lashonda? Well, I think in some situations, I mean, some situations you can't advocate for yourself, but I think it's important to recognize that I am a doula and I have my own children, and that during that process, I needed to bring other people in to support me because that is very mentally taxing. It's a lot of work. And so I want to have support ready for myself as well. It doesn't matter that I'm a trained doula and that I do have the skills. I do recognize that I at times cannot advocate for myself in the moment, and I need to add an additional support person. And I think recognizing that is important. That's why doula work is very important. And it really starts early, sitting down with your doula, talking about your vision for the day of birth, for the pregnancy, after you give birth, what you envision that experience to look like, and write that out. Have that support ready for you. Family members can advocate for you as well. You can sit down with your family, talk about your wishes, what you hope that day will be like, really discuss what the process will be like, and tell people how they can help you and support you during that time. So you don't always have to feel like the responsibility is just on you, that I have to give birth and I also have to do all of these things. You can let other people take care of you and let them advocate for you as well. Yes, excellent point. Thank you. The next question is, when do I need to go to the hospital? And what do I do if there is no interpreter when I arrive at the hospital? Well, I typically tell the patient, go to the hospital when you are having contractions, when they're about every 3 minutes to 5 minutes apart, and last a minute in duration. And that entire cycle has been going on for an hour. You have to request an interpreter if one hasn't been requested already. And really, all hospitals should have at minimum access to VRI. And really, most hospitals can call an in-person ASL interpreter as well. It definitely is a challenge, and you it's really the hospital's responsibility to figure out how to get the interpreter there for you to support your communication. Next question. Are there any red flags during the fourth trimester that we should notice? Anything that is a warning sign? Well, like Tiffany mentioned before, you can get the baby blues. And that's usually during the first 2 weeks after giving birth. If you notice yourself crying a lot, or feeling very off, or feeling like your emotions are a roller coaster, that can be normal. And really, 80% of all birthing people will feel, maybe 1 week they feel fine, the second week they feel fine. Um, or I'm sorry, it's normal to feel it during that time. But if that anxiety and depression continues past 2 weeks and it feels like you are often depressed or anxious, then that would definitely be a warning sign that you need to speak with your provider, maybe get a mental health counselor and explain what's going on, but you need to tell someone how you're feeling and ask for help because that continuing depression or anxiety is not typical. Or not to say it's not typical, but that's an indication that you need help and need to ask for an indication that you need to ask for help. And I'm sorry, Kim, did you want to add something? Yeah, I have a couple of other things that are simple but important regarding red flags. If you have really bad headaches and that's a new symptom for you, if you feel like your vision is blurry, if you feel like you're having pain under your rib cage, that could be a warning sign that of preeclampsia after you give birth. Also, if you have really heavy bleeding, um, and if you're going through more than one pad per hour, it's important to let your provider know. And also, if you need to consider your moods. And those are the important things that I could think of. I mean, of course, pain is normal, breast soreness, um, pain in your abdomen is normal. But if it's very severe pain, if you feel like you've been hit by a truck, that is a good reason to call us. I mean, sometimes you'll have some breast swelling, um, and some pain, but if it's severe, it can be a sign of an infection. So it's always good to check in with your provider about that. And what about self-care? What does that look like after someone gives birth? Well, that depends. Depends on what you like, depends on what you want. It's important to eat foods that you like. It can be letting other people take care of the baby while you binge watch TV. It really depends on you and how you feel and what you need more of and what can help you feel energized again. So you really need to figure out who can help with that and who can help you make that plan and carry it through. And Tiffany's saying, I just want to add to that that it's not just about someone else taking care of the baby, but someone else helping with chores and making sure that when someone else isn't taking care of the baby, that you're not just doing other chores, but that you're actually taking time to rest. And Kim saying, yes, you definitely need to take advantage of the times that you can sleep. So, and if the people feel, oh, if the baby's sleeping, I need to sleep now too. And you get stressed about needing to fall asleep. But even if you just get into bed and just let your body and mind relax, even if your eyes are still open, that's okay. That's still relaxation. And that's also important. It's not just sleeping. Sometimes it's impossible to sleep. Sometimes you have so much on your mind, and that's okay. That's normal. You can just take that time and rest and relax, and that's plenty.
It's important with family and friends and yourself to have boundaries ready. Okay, is there anything that makes the fourth trimester more challenging for deaf people compared to hearing parents? Like not hearing the baby cry at night and that sort of thing. Glashanda. It's been my experience that with deaf people, I've noticed there's an increased stress because you have to interact with the system. You have to get along with people who ask about interpreters. And now it's not something that hearing people tend to be concerned about, speaking a different language. Hearing people tend to speak English and everything goes along in English. They see a doctor, they get along easily, the communication goes smoothly. So there's an added stress for deaf people, and deaf blind people have a very big concern with professionals. Another thing is professionals who assume because the person is deaf or deaf and blind means that you have less ability to take care of your children. And there are a lot more questions. Well, how are you going to do this and this and this? How will you plan to take care of the feedings? And it makes us feel it's like we don't know what to do. And professionals who know nothing about deafness or deaf-blind people or deaf people have more concerns. And I've noticed more people experience uh, children's services. They're identified as children's services because, and I've noticed this in my work, so I try to plan for their future interaction with the system to make sure that they don't have a negative interaction with the system. Okay, now if I feel sad or overwhelmed once in a while, like once a month, like after 2 weeks, is that considered postpartum depression or baby blues, or is that just normal? Well, I would say,
Sorry, I was just reading the question. Yeah, I know you're looking at me, but I was just reading.
yeah, once in a while it happens, but that's life, once in a while. Wow, that's good. I have that every day. So, no, but really, seriously, no. If you feel that you're yourself most of the time and you're just going along pretty fine, yeah, I'm doing okay. And then it hits you, it's like, wow, you're feeling overwhelmed. And then you go back to feeling like yourself. That's okay. That's normal, yes. And I want to add that if you ever feel like, I feel, I don't know if I'm okay, Or, and I'm so sorry, Kim, you have to take over. My screen is frozen.
Yep, if you're ever feeling, that you're not sure if you need help or not, you can always ask your provider, and you can always talk to your provider about your health in any aspect, your physical health, your mental health, your baby's health. If you have any questions, go ahead and call your doctor and ask. And if that provider is unsure, they can refer you to a different specialist. We're not experts on everything. And it's really a new experience for new parents, and your whole world has completely changed and you're just dropped into it. And if you feel like that, that's totally okay. There are people out there that know, that specialize in this work, and they are there for to answer any questions that you have. The last question is about boundaries, which is, speaking of boundaries, when is a good time to allow visitors to come after you've given birth? It really depends on the individual, Kim is saying, and Glashanda as well. Yeah, it's also kind of a cultural thing. For example, for me, I'm someone from a different culture, and we usually have someone there to support during birth and then stay for 6 weeks after someone has given birth, but who has not been there for the birth. And no visitors except for the people that are helping really gives the birthing person time to rest and let the other children be taken care of by the support person. And then after 6 weeks is when, in my culture, in our culture, that it's normal to start having visitors. And I do notice a benefit for that. I know that today it's not always possible because people need to get back to work. They need childcare for a variety of reasons. And so I agree with Kimberly that it really is an individual decision. And you also need to think about what benefits you and your family. Yeah, and I will say, just from my own experience, while I was in the hospital, or working during COVID, it was limited to just the birthing person and their support person. And then when they went home after a day or sometimes 2 days, there was a lot more, bonding time when there are not other visitors in the room. So really take advantage of not getting overwhelmed with tons of family. Give yourself maybe a week, because I do notice that there really is a benefit to that, to just be with your new baby and your partner and just your immediate family. And that really just helps you get used to your new normal. Okay, does anyone have any closing remarks for about the fourth trimester? Oh, Kim? No, no, I didn't have anything. I think I think I've already covered everything. Okay, well, this was a wonderful presentation. Thank you so much for your comments and your thoughts. I want to thank the captionist and the interpreters and the Deaf Health Talks planning team. I really appreciate everyone's involvement in making this event possible. Thank you so much to our panelists. You all had great information to share. Thank you so much. And we look forward to the next Deaf Health Talk coming up next month, and we will send out information about that. It will be the fourth Tuesday of every month. Okay, everyone. Thank you so much. Have a great evening.